So reward, tolerance and dependence are considered the three components of addiction. People start engaging with mood-altering substances and behaviours to feel good or to become more confident. Over a period of time, they need to take more to produce the same effect. If they stop using, they get the opposite effect to reward and go into withdrawal. They start the drug again to stop withdrawal. This, in essence, is drug addiction. The repetition of a pleasurable, rewarding action is called positive reinforcement. People take drugs for many different reasons: to feel good, confident, relaxed. All of these effects constitute a payoff or reward to the user. The reward system is part of our survival kit, which has evolved to ensure the survival of the species and make essential activities such as eating, drinking and sex pleasurable. The brain releases natural reinforcers, opiate-like neurotransmitters, which raise circulating dopamine levels and create a feeling of satisfaction. Drugs of abuse are chemical surrogates of natural reinforcers, but more powerful and persistently rewarding than the natural reinforcers to which the human brain is accustomed. Continued exposure can initiate increased drug-seeking behavior and set the stage for addiction. Drugs cause changes in the receptors to which they bind, making them less sensitive. This creates tolerance, the need to take larger amounts of a substance to produce the same effect. People use for those rewards, but they progressively fall short of their reward or their payoff. This creates the need to take larger amounts of a substance to produce the same effect. Dependence is the need for continued use to avoid withdrawal. If a person stops using, they get the opposite effect to reward and go into withdrawal. Severe physical withdrawal symptoms are usually opposite in nature to the drug's acute effect and include anxiety, emotional agitation, depression, tremors and sweating. These effects are devastatingly painful. Starting the drug again brings prompt relief. The addict now needs to use more to function and to satisfy the cravings they feel. They no longer experience reward from their using, are tolerant to the effects of their drug of choice, but dependent on its use. They are now locked into the cycle of addiction. So if you're able to identify or feel you do have a drug problem, please contact a mental health professional.